Medical treatment of colorectal carcinoma. Analgesic medicine NSAID, they are used along with limited and tailoring dose of the steroid. To reduce the chances of constipation, we can use laxative medicine and the vegetable diet. Excess amount of water is essential to maintain the health of the gut. Aspirin in low dose, that is Loperin 75 milligram, can reduce the pain and is useful. But the excess amount of aspirin that may produce ulceration and bleeding. The traditional methods and the medicines used are chemotherapy. Chemotherapy or the set of medicines or group of medicines used to destroy the cancer cells by oral route, pills, or in the shots. But the traditional or conservative treatment of chemotherapy has drawbacks that it also harms the normal tissue, surrounding tissue, normal tissue around the cancer or the tumor location. So now we have using targeted therapy. In this group, the medicines are used which only kill the cancer cells, damage them, finish them, but have no side effect or the toxic effect to the normal tissue of the surrounding organs. Immunotherapy. In this group, medicines are included which has no direct effect on the cancer cells, but these medicines potentiate, activate the activity of the immune system of the human body against the cancer cells. Immune system is the defense system of the human body which consists of WBC sets and group, plasma cell, lymphocyte, T cell, B cells. All these come into action to kill the infection and the foreign body. So these medicine guide this immune system to, to tell them, to guide them the location and site of the tumor, because it is property of the cancer cells that they secrete such elements, maybe protein or other ones, that produces a fort-like wall, a wall around the tumor, due to which the cells are hidden. They are not exposed one. So the in normal process, it is difficult for the immune system to detect the location of the cancer cell. So these immunotherapy, immunotherapy medicine, they help and they damage the wall, protective wall of the tumor, and also guide them, the immune system, to get entry into the site of the or the tumor, to attack them, to attack the tumor and to destroy and kill that one. So this is the function of the immunotherapy. Now there is another process. Instead of medical boosting the power of the immune system, we extract WBC from the blood of the patient and we develop those WBC in the laboratory, provide the vaccines and the other chemicals, and to give them, to make them powerful, to create ability and boost up their ability to kill the infection. When they are mature ones, they are boosted, powerful ones, they are ready to attack the infection, then we inject or re-inject, we can say, back into the blood of the patients. So these are the powerful, vigilant, active and trained one against the tumor cells. So these are the various processes. Now radiotherapy. It consists of the power rays, X-rays and other ones. They are provided from the external machine to the tumor where it is located in the gut or in metastatic places, and we establish or maintain the position of the radiation to the site of the and location of the tumor. So these rays, they kill the damage the tumor cells, and this is external irradiation, radiotherapy. There is brachyradiation method, I mean internal method of radiation. For that we radioactive seeds, they are injected through blood to the site of or in the tumor or around the tumor, and they constantly damage, constantly attack the radioactive radiation produced by these seeds, constantly damage, constantly attack, and constantly destroying the that is the tumor cells. They are the permanent internal source of the rays. They are lethal to the cancer cells, not the normal ones, comparatively. So these are various method of treatment of the colorectal carcinoma, or it is a routine for all carcinoma in any organ of the human body. Surgical treatment of colorectal carcinoma. There are two types of surgery adopted: open surgery, and second is called laparoscopic surgery or keyhole surgery or robotic surgery. Open surgery, incision is given through the abdominal wall, and the damaged portion where the carcinoma is growing, that is excised. It may be in the left hemicolectomy or the right hemicolectomy process. The affected or the damaged wall or the portion of the wall intestine, that is excised, and the healthy endings, they are sutured, they are anastomosed or sutured one. The dead portion or the tumorous portion is excised and put out of the body. So it is an open surgery. The healing time is prolonged. Chances of infection, hemorrhage, inflammations are limited one. It is the surgeon has a wide range of surgical manipulations along the around the tumor. The other lymph nodes and the other soft tissue, they are also excised. They are washed away. Surgeon has free hand to make a very delicate process of surgery in open method. While robotic surgery has a benefit that in this way or in this method, the recovery time or the activity of the patient is earlier. Within few days he can perform his normal duties. And now laparoscopic or the robotic surgery is performed in appendix operation, gallbladder operations, and also with the intestinal operations. Now, when the in robotic surgery, there are 3 or 4 holes are made, wounds are made in the abdominal wall, holes through which there is a electroscope that is passed, which is called as robotic surgery. The instrument is passed, which is fitted with the camera, light, and in through other holes we pass for air and the water irrigations. So, and next another hole is made for the passage of the surgical instruments. So this robotic surgery is done by the skilled robotic surgeons because it has a special field of training and course. So it needs a very delicate surgery one to avoid the infection, inflammatory process and the bleeding afterwards. Sometimes we produces stoma. That is when we think, a surgeon thinks that there is a prolonged time is required for the regeneration and healing of the operation of the large gut, then small gut is stretched out of the abdominal wall, make an hole, and there a bag is fitted. That is opening is called as stoma, and through that stoma, the fecal matter is passed out into the bag. It may be a temporary process or it may be a permanent one, according to the condition of the carcinoma. If carcinoma has a curable or the good prognosis that the large gut and the including rectum and the anal canal that resume normal activity after operation after some period, then it is a temporary one. When we have to cut the whole system of defecation, for this is a alternate method to defecate the fecal matter out of the body through the stoma. So surgical procedure is a very delicate and process is very beneficial and life-saving ones because this is the only way that we have to get rid of the tumor by excision process, while the medical treatment is only a temporary one to relieve or give temporary relief to the patient.